Now this is the 12th problem is again IV problem, but this time it's asking you within the 2 hours how much have you infused. That's your input. How much have you input for the 2 hours? Because if you read the question, it says an IV infusion was started at 9 a.m. at 50 drops per minute. The IV said it delivers 60 GTT drops per mil. It is now 11:30. So you've given something in 2.5 hour times. How many mil have you infused so far between 9 a.m. and 11:30? So this is how many mils. So we are going to do number 12 here, and we are asking mils. Always remember, whatever asking, you put it in there first. And we have 1 mil over 60 GTT. I'm not asking about GTT. We have been giving 50 GTT per minute, if we look at it. And our IV infusion is that we have, this is where the formula changes. Instead of putting 1 hour over 60, we're going to put 60 minutes over 1 hour, because I'm asking total amount of infusion. And we have been doing it for 2.5 hours over 1. So the hour and hour cancels, the minute and minute cancels, GTT and GTT cancels. So how much total have you infused in mils? And if you look at it, the total is that it will come as 2,500 over 60, which the answer is 125 mils is the total amount that you have infused. This is 125 mils, guys. Let me put it here. 125 mils has been totally infused for 2.5 hours. Total amount you infused was 125 mils. Mils is what you want to get into. And I will explain more of this question if you are struggling in class. Please let me know about that. So let's go to number 13. Please know this question because I have seen this type of question in your NCLEX exam. So please understand this question number 12. Let's go to 13. A patient is to be given acetaminophen, which is Tylenol, 120 milligrams PO every 4 hours. Every time you give pain medication, it should always be a PRN motor. That's why it's every 4 hours. The bottle reads 160 milligrams per 5 mils. So how many mils will you give this to a child? So we are again asking for mils. Understand that. And what do we have? We have 5 mil in 160 milligrams. All right. The order is given, we're supposed to give is 120 milligrams over dose. Or you can write here every 4 hours. But please do not calculate this. This is just overdose. This is, you are supposed to give every 4 hours. Don't calculate it. So the total is 600 over 160. So really you're giving 3.75 mil per dose. Or per every 4 hours. So you can write either one. 3.75. Again, mil, because milligram cancels, only mil stays there. I hope you're understanding how this is followed and why you're ending up with mils. I've been telling you for a long time. Let's go to number 14. Number 14 says dexamethasone. You need to know betamethasone and dexamethasone. Betamethasone is something you need to know about the drug and when we give and how we give. I'll explain that more as we come into our clinicals as well as in class. Please know that medication though because of your medication exams. But this dexamethasone is a steroid. Anything that has a zone in it is a steroid. Is ordered for a patient who weighs 5 kilos. So we are giving this to a newborn baby, a child. The dose order is 0.1 per milligrams per kilo per day divided equally every 12 hours. So how much milligram are you going to give that child? So now we are asking for milligrams and it is 0.1 milligrams over 1 kilo. That's how much the medication comes in. Our child weighs 5 kilos and we are supposed to give it over 24-hour period. But we are supposed to divide it into half, 12-hour over dose. So you understand what I'm doing here. Hour and hour cancels, kilo and kilo cancels. The only answer is left is milligram, which is what you're supposed to give it in. So you are supposed to give him this child 0.25 milligrams per dose or every 12 hours. So please understand that. What is remaining is what you write there when you cancel. We are going to come to number 15. 15 is more or less the same as above, but in mils instead of milligrams. An order is written for Demerol. Demerol is again a pain medication. By the way, Demerol is no longer recommended, and we are Christy and Wesley are going to completely remove Demerol from their pharmacist area. Demerol is not a drug that you should give to a child or a pregnant mother. So written is Demerol, or even a postpartum mother. Demerol is given 50 milligrams IM every 4 hour PRN for pain. Again, this is an opioid. The available preparation contains 100 milligrams Demerol in 2 mils. How many mils are you going to give this dose? So in each dose. So we have to give mils. Alright? And our mil is, we have 2 mil over how much? 100 milligrams. Right? We are supposed to give this person 50 milligrams per dose. Are you with me? Or every 4 hours. You can write every 4 hours if you want to, every 4 hours. But you're not supposed to calculate this. Alright? This is every dose. So this is milligrams. Answer is, when you look and do it, it's 100 over 100. If you look at it, 50 times 2 is 100 and 100 over 100. And that equals to 1 mil every 4 hours or per dose. Either way you write, even if you write every 4 hour PRN, I will take it. So please understand, again we are ending up with mil because milligrams and milligram cancels. We want mil, and the end result should be mil. Thank you.